Hello, everyone. Welcome. Okay, so now we are live. I have completely forgotten. You won't believe it, guys. I was sitting there like, why is there not many people? Why is nobody talking and whatnot? Why isn't anything working? It's because I forgot to press the start streaming, and I also forgot to change out my stream key and whatnot. So now we're live. Now I'm going to have to go over this whole thing all over again. Okay, so where was we, guys? Okay, so CPR. Okay, CPR. We're going to start with this, okay, guys? I'm going to go all the way back from where I have started, okay, guys? So, essentially, we want to be able to understand why do you want to make a medical kit for your backpack or your car. Per se, I like carrying my my medical content inside of my backpack because wherever I go, my medical goes with me, not just sitting in the goddamn car. And say, for example, I'm taking a hike, and a 6-mile hike. Something happens. I have like a bear attacks and so bites one of my friend's arms or something, right? And then I shoot the bear and I kill the bear, right? And then my friend's bleeding out. Or say, for example, the most common scenario for most people would be when people are, say, for example, a car crash. Most of the time, you're more likely to get into a car crash in America than, say, a self-defense shooting or somebody trying to mug you, somebody's trying to rob you, or let's say, for example, somebody got working and injures themselves or on the construction work site or anything. That's not as often going to happen, but there are chances to that sort of thing to happen. My brother, for example, none of us ever actually in our whole life inside of, let me make sure I'm actually streaming. Yes, hello there, guys. Hello, how are you guys? Okay, thank God. You guys are actually there. So most times people are going to do, most people probably say, I never got into a car crash. The same with our family as well. Like, my family never got into a car crash, really. We never really got into a severe car crash or anything like that. My bro got into 3 car crashes this year, okay? So, just to say, well, this never will happen, watch your words, because it could happen, and it's going to smack you right in the face if it ever do happen. So, just keep that in mind. So, it's better to be prepared than not prepared, and that's what I always say, okay, guys? So, we're going to build out this kit, and one of the first things that I'm going to say is that we have to have is a CPR certification. If you guys aren't certified or anything, get a certification, understand what it is. An adult CPR would be done with 30 to 2 or 30 compressions, 2 reps, or 2 breaths, 30 compressions, and about 100 to 120 beats per minute. And here's the thing, guys. You're going to have to do this correctly, okay? So, you want to be able to be pressing it down right about here, okay? We're going to press them down right about here, okay? And we're going to press deep, okay? This is going to separate these cartilaginous, what is it called? Like, ribs and stuff, right? And it's going to be able to separate it, and then it will press down into the chest cavity, thus pressing the heart up against the internal body cavity to allow proper chest compressions, and thus push the blood throughout the body. And those 2 breaths will also be able to send out some oxygen into the body as well. And when people do go into ROSC, you have to understand ROSC is it's I gotta search it up again. ROSC CPR definition. Okay, ROSC is the return of spontaneous circulation. Okay, and so essentially, when people go into ROSC, guys, you're going to have puking. Okay, people gonna be puking. I've heard one of my paramedic partners. He said, "Fuse, the first thing I had was like." When I was running a call, I had to do chest compressions continuously, and I had to, basically, this guy, he had Rosk on me 4 or 5 times, and he puked on him in the ambulance to the hospital 4 or 5 times, and also 1 on scene as well. And so essentially, I don't know if that guy, like, per se has survived or anything, but hey, the fact of the matter is you're going to get dirty, okay? To save somebody's life, what do you want? Do you want to get dirty? You're going to have to get dirty, okay? Things are not going to be clean when you're trying to save somebody's life, okay? So that's when I talk about the CPR mask, boys and girls. The CPR mask allows you to keep the body fluid. Say, for example, this patient has STDs and all this sort of stuff. You know, he's probably have like some bloodborne disease or something, or saliva transmitted disease, right? We don't want that, okay? We don't want that. So that's when this bad boy, the CPR mask, comes in, okay? And so we will take a screenshot of this. This is going into our backpack, okay? Or you could get one of these, and you can also do this like C sort of motion and whatnot, like this hand motion. Make your hand into a C, and that's what you'll see, okay? So we got a CPR mask, okay? Or you can get one of these bad boys. These bad boys, they're like, it's literally just a piece of plastic, okay? And you're gonna be like, okay, Fuse, what the heck is this? And here's the thing, guys. This thing is basically, you're gonna fit it over their face, right? And then you're going to put like the C kind of, what is it called, thing around their mouth. You're gonna blow into this little hole area, you know? And so essentially, I would say you could either have this as a keychain thing, which I personally am gonna get one of these as a keychain thing, because, you know, it seems like a really cool thing, and I also don't need to really worry about, like, scrambling through my backpack when I need to have this thing on me, you know? And it's also pretty durable nylon and everything like that. So we'll go ahead and add that to my, what is it called, our little tiny list as well, okay? And if you guys are wondering, Fuse, I can't see it, well, now you can, haha. So this is probably not going to be in your backpack, but, oh boy, a little high-tech thing. This is going to be on your keychain, okay? It's going to be on your keychain. So, it's a really small little thing. It's literally just like put your 2 little fingers together, and then that's probably just about how small that is. And it's just $7 for like 6 of these things. They're like real cheap and stuff. So, hey, it's not that bad. Like, come on. So, you can't put a price on a person's life, okay? So, stop being, what is it called? Greedy, per se, okay? So, hopefully I'm streaming. Yeah, I'm streaming to 0 people, but hopefully people will go and check this later on. So, moving on, we don't need to have a needle D because none of you guys know how to do that, and neither am I going to try and do that. That's paramedic level stuff. Okay, boys and girls, don't try and do it. Don't try and do it. So, now, moving on to an ETD, so a trauma dressing. Oh, before we go into ETDs, like a trauma dressing and whatnot, we need to understand about compressed gauze. Specifically, what I like to do about compressed gauze is law enforcement compressed gauze. Leo compressed gauze, which is basically these things, okay? They also have like a hemostatic agent on there, hemostatic gauze, which has this hemostatic agent gauze, and this is kind of like my favorite thing. And no, they're not $40. I don't think they're $40 for just for one of these things, because I feel like you could get one of these things like for a lot more cheaper than that, okay? And say, for example, let's see. Hold on, wait a second. You guys can't see a dang thing again. I gotta remember that. Okay, so law enforcement compress gauze for hemostatic agents. And so here's one thing I would have to say. Let me go to T-Rex arms. They probably have something, dude. There you go. See that? They have the quick clot right here. Quick clot. Oh, it is $43. Okay, well, this is the one, boys and girls. This is the one. It is $43, and, I mean, again, you can't put a price on human life, okay? If you're gonna put a price on human life, well, then what are you doing, okay? You can't do that, okay? You can't do that at all, okay? You can't do that at all. So, we're gonna put that in my little list. I'm not gonna show you guys it, because obviously I don't want you guys saying, oh, I can't see it and stuff. Oh, I don't want. Well, too bad. You're not at least seeing it. So, essentially, this is kind of what I have on one of my, what is it called, my belts and stuff. I'm going to have to buy one of these, like, later on, per se. But this is also where we also have the NAR compressed gauze as well, because the thing is, not all the time are you gonna probably need to use that. So this is my favorites. This is my kind of like my per se favorite thing I could say is these things. They're actually pretty cheap, okay? They're actually really small. Matter of fact, I have 2 of these inside of my, what is it called, my little gym bag, you know, my little gym fanny pack or something like that, you know? And so this thing is right here, it's pretty gnarly, okay? Hold on, wait a second. We gotta get rid of that, okay? Hold on, wait a second. We gotta take a picture of this, okay? I'm gonna also sum up all the prices and everything as well later on, so you guys be sitting there and be like, okay, get a good understanding of how much all this stuff will be, okay? So, okay, now, we got this, okay? Now, these things are pretty gnarly, and I could say this as a fact of, like, how I used it and stuff, and this is also one of the things, because why I say you could get 1 or 2 of these things is because, let's say you don't need to pack a wound. I don't think I'm going to use my $43 Teleflex Quick Clock Combat Gauze and to, like, wrap around, say, person's, like, holding a splint or something, because, you know, you could basically use one of those things, but that's when you could use an ETD. So, here is basically how you would use one of these quick clots, okay?
Gauze. Keep in mind, you can pull from the center to actually pull that gauze out from wound pack, and that's a lot of times easier than unraveling it from the outside.
Yeah, see that?
Come on, buddy, stay with me.
And then you're gonna pack it in. And so you guys are gonna be wondering, like, Fuse, now why would I want to be able to, like, pack it in? Would I cause any more damage and stuff and whatnot? And you could use this for junctional bleeds, like, say the hip, there's like a bleeding inside of the like an arm, or definitely not the chest. Don't try it. If you guys try it, I'm gonna be real mad at you guys. You're just you're filling up a giant hole. Don't do that, okay? Okay, so junctional wounds, you could also do it for, like, wounds inside of the thigh or inside of, what is it called? Inside of the arms as well and stuff. So you could use these, and that's when this one comes in. Quick Clot is designed to be able to clot up that area as fast as possible, because the thing is, as well as you have to put that there, you have to add you have to add pressure after filling it up. You gotta press it deep inside. You gotta press it in and stuff. You got to do as much as you can, you know? And so essentially you could use this for, like, even as, like, this one as, like, an ETD. And this is when I come in with this one, ETD, okay? Not that. That's not what I'm looking for. We're not talking about that either. We're talking about, nope, not chest seals yet. We're getting to chest seals, okay? We're getting to chest seals. Oh, let's see about this. Powder doesn't work. Let's see. Let me see. What's this? Warning, I told you guys that this is going to be weird. This is going to be, like, pretty bad and stuff. Wash out the bleeding. And granular washout of the blood wounds. Okay. Oh, okay. So they're trying to say that it doesn't. Okay, so yeah, that's also what we've went from, and so that's when we came with the hemostatic agent gauze. And here's that hemostatic agent gauze going in. You're gonna pack those in, and then you have to have a pair of gloves. I forgot about that. You guys have to have a pair of gloves as well, guys. Okay, you can't forget about the pair of gloves, because the thing is, we have to get a pair of gloves. Nitrile gloves, because, you know, nitrile gloves by price, we'll just say under $25, because you can get those sort of things. Get a box of nitrile gloves. You know, I can't remember the last time I never needed to use one of these things, okay? Get a box of these things. Pack them in your pants or something, you know? I carry a pair of gloves inside my back pocket all the time, dude. So, get one of those, put them inside of a little tiny bag, and call it a day, okay? You're gonna need one of these things, okay? In your med kit, you're gonna need one of those things. You don't want their blood inside your fingers and stuff, and things just get worse from there. We don't need that open. I don't know why is that still open. You see this? You're gonna pack that wound. You're gonna keep packing it as much as you can, and you're gonna see that it's stopping the bleed. And so you're gonna put pressure on there, And then you have these ETDs coming, okay? Now this is where we have the Israeli bandage, okay? Israeli bandage, okay? Bandage? I think that there's one for North American Rescue as well. So there's like the Israeli, what is it called? Like bandage or dressing, battle dressing. That's what I have on one of my, what is it called? Inside one of my bags and stuff. Or you could go also for North American Rescue, what is it called? What do you call these? Bandages. And here's the thing, guys. These things are awesome. But this thing, you have to understand, this thing is chunky. This ETD is chunky. Okay? Now, why am I showing you guys all this from Amazon? You could also go to North American Rescue's website and you could be able to actually get probably some deals and stuff over there if you're a first responder as well. But, you know, Amazon is pretty cheap, okay? So we'll just stick with Amazon for the normal layperson who doesn't they're not law enforcement or police officers or any of the first responders and whatnot. So we'll keep on going on from there, boys and girls. Now that we have that, this one right here, we'll wrap that around and keep that area, what is it called, clean. And so this is when we talk about ETDs, okay? So let's see. This is the demonstration of the Israeli bandage, or you could use it like the North American Rescue one. So here's the thing right here. Yo, what's up, buddy? Hello there, Joe Mama. Hand reveal? Nah, bro, you're not getting a hand reveal from me, my man. No hand reveal from me right now. You can actually go to my Twitter page where I actually did do a hand reveal of me holding a 5.56. No hand cam, man. No way. Not today, because I don't want to be able, like, I don't want to take out all of these things, like, out of my backpack and everything. And then I also don't have, like a really nice hand cam per se. Like, that's the only also one more reason. So that's also like why I don't show my hand cam and stuff. But probably one day I'll probably do a hand cam, and it's probably be on it'll probably be on Twitch if I ever do a hand cam, because I'll probably do like just chatting and you know, cleaning my guns and stuff, like my rifle. I put like 160 rounds through my rifle in the past month. Last month. Yeah, last month I did about 160 rounds through my rifle. So once we get those numbers a little bit closer to 500 rounds, then I'll start cleaning it. And probably I do a hand cam. You probably guys see it inside of Discord before that. I don't even want to stream or Twitch, dude. I don't have time for Twitch, setting up all that sort of stuff. But that's how it is. So my Milky sub expired. Oh no, that sucks, bro. I think my Milky sub just actually, gone another one. I have only joined one of her streams, dude, and I've never went back to one of her streams, dude. I am so sorry, guys. I want to watch Milky, but I can't. I don't got no time to watch streamers as often because your boy's also a streamer, man. Oh my god. But here's this, what is it called? Here's the Israeli bandage, or basically the bandage, compression bandage to demonstration in general. How do you use it and stuff? So you see this right here?
You're going to go through that cleat.
You see this right here, boys and girls? You're going to go through that thing. You're going to tighten it down. You're going to cinch it.
What that's going to do is you want that cleat where that tension's pulled to be directly over the wound.
Yeah.
Because what that's going to do is provide tension through this cleat right at the point. So let's say my cut was right here on my kneecap. I'm going to directly position this to be centered over my kneecap. So as soon as I pull this over, I'm going to feel that pressure right there on my kneecap.
Yeah.
And I'll keep taking this around, and you can see that little piece of string breaks as this continues to get pulled around.
Yep, see? And that's what you want to be able to do as well. And this is what I would carry this inside of my med kit or my belt. But the problem here is that thing's so chunky. This thing's so chunky, dude, that it's kind of uncomfortable wearing on the belt, you know? I gotta go, Fusey. Okay, see you later, Joe Mama. He also says, WTF, you got more gifted subs than me, bro. I know, bro. I kind of gone for the premium, bro. Okay, I got the premium. Oh, my goodness. So, yeah. Okay, I'll see you later, Joe Mama. Have a good day, my man. So, going forward.
This piece here. And all you're going to do is
anyways,
put that in,
bye-bye.
the top and
Bye-bye.
the bottom, and your Israeli dressing is complete.
And so there we go. That's your dressing right there, boys and girls. And that's what we want, okay? So, that's what we want. So, now that we have, let's see our build, okay? You see this? Hold on, wait a second. What the hell did I just do? What did I do? Okay, there it is. Why is it not showing? Ah, there it is. So, now you guys see it. Now, do you guys see that? We got the CPR masks right here. We got our compressed gauze. We got our compressed bandage. We got our nitro gloves, okay? Now, these things are going to be essential, okay? These things are essential. I wouldn't go for burn tech, like burn dressings and stuff necessarily, not necessarily, because it's for more like first degree burns. If you really want to have a burn dressing, you can go ahead and toss this in. But most of the time you're not going to have that. And if you were to come across a chemical burn, say for example inside of a chemistry lab, which I had inside of my lab, one of my classmates had a chemical burn, and I just told her just run it under cold water for like 15 minutes. Because the thing is, if it's really a bad burn, you're going to have to need to, get that wrapped up in some sterile gauze, or keep it running underneath cold water and stuff, and just rush to the hospital and stuff, because they do have, some type of other chemicals to stop that chemical from burning the skin, and alkalize does more burning than anything else. So you want to rinse it with cold water underneath cold water for 15 minutes and stuff. So anyway, moving on, chest seals. Now, you guys are probably wondering, Fuse, why chest seals? Now, here's the thing, boys and girls. Chest seals will help with open chest sucking wounds, okay? And this is where you'd have an open chest seal. Why is this so bad quality, dude? I have okay, reload. I want to see stuff in 4K. Okay, I can't see nothing in 4K with this. Okay, whatever. Okay, this is a good demonstration though, okay? Got his plate into his face. Doesn't matter, guys, because it's a life and death situation. He's checking for open wounds, open chest wounds, and in the front and also in the back. Say for example, somebody got shot in the chest, or you got or got stabbed in the chest. You want to make sure most of the time when you have stab wounds, you're only going to have just the open of one side that is going to be open and stuff. You're going to also need to have shears, guys. I don't know how to say this, but what the heck, dude? I keep on showing you guys nothing, dude. Oh my god. Okay. Gotta keep this in mind. Okay, now we're gonna go back over here. And so, essentially, what you want to do is you're gonna have to have chest seals. And say like I said before, you're gonna have to need definitely that sort of open, you're gonna have a chest. If you got shot in the chest or somebody got shot in the chest, most of the time they're gonna have an open front chest wound, and they're gonna have also a back hole as well. Say for example, a rifle round would just go right through most of the time, and if it's a pistol round, 9 mils or something, sometimes if it's a hollow point, it's probably gonna stay inside. But just to be sure, always check the back side of the chest as well, because the back side of the chest, the back as well, because they always have an entrance wound and an exit wound, And so we got our shears, which you could get a shears, literally just toss shears inside of here. Okay, we're just gonna toss shears, and don't go for some stupid expensive shears. Okay, you don't need stupid expensive shears. Just get one of these. I carry one of these. Okay. I literally carry one of these ones. I think I got a 3-pack one just because I like the 3-pack and stuff. But, you know, so just go for something simple like this, okay? These things right here are pretty decent. Oh my God, just show me this. I need to take a screenshot of this, okay? You see these are pretty decent, okay? These ones I really like and stuff, and these things, they pretty much get the job done and stuff. So don't need to overcomplicate things with a stupid amount of like stupid expensive stuff, okay? I have one in my bag, I got one on my body, and one I have on my body, guys, you'd probably be like, okay, guy, okay, what are you talking about? Stupid expensive shears. Okay, here's this shears. Shears, hold on. Raptor shears, okay? These are the stupid expensive shears that I'm talking about. Do not buy these, okay? If you don't have the money, don't buy these, okay? Because the thing is, it is better to buy 3 of these. You can find a 3-pack somewhere on Amazon and be able to put one in the bag, one in the, what is it called, the trauma, your fanny pack when you go to the gym, and one on the, what is it called, med kit, or your belt, or inside of your vehicle and whatnot. And so you can have these things like scattered everywhere. Or you could go for this thing and keep one on your body at all times. And here's the thing about why I carry one is because I was working on helping other students with their EMR training and stuff. And so in my payment for working and helping and everything with that, what is it called, that training, my friend, he was, what is it called? He's a really nice guy, dude. And he gave me one of these things as a gift and also as payment for working with him in teaching the students and everything. So that's what I'm saying and whatnot. Don't go buy some stupid expensive shears because, look, guys, when you're going to, this is actually some really nice shears. These are actually really nice shears. But anyway, when you go and when these get bloody and stuff, let's say, for example, if it gets real bloody and whatnot, and you can't autoclave it and you can't clean it correctly and stuff, you're pretty much done. That thing's got to go into the trash, okay? Because it's dirty as heck, okay? So, as much as I love these Raptor shears, I don't recommend anybody buying them, okay? If you don't have the money, okay? If you guys really want to throw money at the wind, go ahead, do it, okay? I don't care. Now, this is going to be the chest seals, okay? He has his chest seal. He's opening up his chest seal. These are, I believe, no, these are not the vintage chest seals, okay? You're going to put that there. You're going to put it on his chest, and it will stop the sucking chest wound inside of his chest, okay? And this will prevent that, what is it called, that thing from, like, any sucking, you know? And it'll keep it from also keeping the blood inside as well. So this is also when we also have the thing. This thing, guys. Oh my God. Here's the thing. We're gonna have we're gonna have tension. What is it called? We're gonna have like it's called tension shock. It's like it's what type of shock is it called when the lungs is pressing against the obstructive shock? That's what it's called. Obstructive shock, guys. Obstructive shock. That's what it's called. Obstructive shock. Okay? Obstructive shock is when, what is it called? When the lungs, say, it could be like the lungs pressing up against the heart, preventing the heart from functioning as a pump. Okay, that's when obstructive shock happens. It can be this lung that completely collapses, okay, and it can basically be really bad and stuff. And so essentially you got this like pneumothorax going on and whatnot, and it's bad. So essentially you want to be able to like put that chest wound and stuff, like that chest seal and stuff, and seal that off, okay? And what I recommend is these, okay? Here's the thing. Hyphen chest seals, okay? Hyphen chest seals. Why am I looking at my keyboard? I never do look at my keyboard. Don't start. Okay. Hyphen chest seals. These ones are my most favorite ones, okay? And you guys probably say, why? The reason why is because these ones are the most compact and most, like, more able to be put around, like, say, for example, you've seen how large that chest seal was, and that one is, like, you know, it's basically doesn't have an opening or anything. You see this right here, these areas right here, that's basically these are right here is like the sticky part, right? The sticky part. This part right here is where you're going to put directly on top of the hole itself. So essentially every time the lungs breathe in, you're going to have, it's going to suck into, like say that plastic is going to go into that, what is it called, a hole, and so it's not going to allow air into that lung cavity, so it prevents obstructive shock. And so here's also another thing: whenever you breathe out, it pushes out any other, what is it called, oxygen that is trapped within the lung itself. This thing is like the most, I honestly say it is overpowered. It's an overpowered technique to prevent obstructive shock, guys. And so here it is. I actually bought one of these things like probably a week or two ago just to pack it inside my backpack. I'm thinking about adding a third one or fourth one later on. So we're gonna go ahead and add this bad boy into this. Let me go ahead and compress it down a little bit more. You guys can't see it, but it doesn't matter anyway. I keep forgetting. So you got this, okay? And here's the thing: what if you don't have what is it called, this, right? You don't have this, but you do have an occlusive dressing, okay? You have an occlusive dressing, which is one of these. Occlusive dressing. Okay? You have an occlusive dressing. Okay? And it prevents sucking of the wound. Okay? You have the, like, I think there's one that is like an occlusive dressing that is where it allows, like, I believe there's an occlusive dressing where you could tape it around the sides. You're gonna tape, like, I'm not sure if it's this one. I can't remember right now, but the thing is, you're going to tape it around 3 sides, okay? You're going to tape it around 3 sides and be able to, what is it called, allow that air to do the same exact thing what the hyphen chest seals does. But I'd still recommend carrying the hyphen vents because these dang things are like freaking cheap and they're also really effective, you know? Yo, what's up, Yoda? How are you, my man? He says, what would you say in the most important thing to have in your trauma kit? Like a tier list. So what is the most important thing I would say is, let's see. I would simply say, my boy, it's gotta be, oh, where's my little list that I had? Okay, guys, okay. Gotta open my little list that I've built out, okay, for you guys. You see this? Okay, gotta get my chat open. Yo, what's up, Risey? How are you, my man? He says, really though? Yes, sir. So, my most important thing would be, I would say CPR mask. So CPR mask, guys. Literally CPR, like the AEDs are in literally every building. I could tell you where inside of my college where exactly most AEDs are at, dude. And I say most AEDs because most of the time I'm in like my science side of the building, and then if I'm not in the science side building, I'm in some other hidden area inside of the building and whatnot. Minding my own business and stuff. So that's what I would say is like the CPR mask. And I just found this thing out, bro. This thing is going to be your most important right here, because the thing is, once you know how to do CPR, you'd be able to do these compressions and also give those 2 breaths, like 30 compressions to 2 breaths. So it's a 30-to-2 ratio on adults. And say, for example, your teacher, right, had collapsed from having having a heart attack, right? You could be able to react, and also when you're not going to have this lip-to-lip contact, because, dude, you don't know what your teacher probably have. Your teacher probably have STDs, okay? your teacher probably have STDs, okay? You don't want you don't want his or her lips touching yours, dude. I swear by God, dude, you don't want that. So you want to be able to have like this little plastic barrier, dude. Hold on, let me go ahead and let me show you guys my screen. I don't want to keep not showing my screen. Let me show you guys. Where is it, dude? Okay, right here. you want to have like something like this. It's just a little plastic piece, dude, and it's just like it keeps your mouth from touching it, and so you'll keep that thing there. So I'd say that is the most important, but all these things are important things, you know. And one of my friends, he actually says, at least I'm spending my money on what is it called, life-saving gear. So hey, I take that as a compliment, you know. You know, so essentially that's what I have to say is probably the most important. But like everything inside of my little build list, what I have built right here is very important, because you don't know exactly when you're going to get into a scene where you need to help, or your family's going to be able to you're gonna get help, unless the teacher is bad. Feel me? Oh, bro. Oh, man. If your teacher's down bad, bro, for that lip action, bro. Oh, God. Oh, God. You don't want that. Oh, God. So, yeah. Anyway, you know. Oh, my God, bro. Oh, my God. So, hey, that'll definitely work out, my man. And, so, yeah. Most definitely that. The hyphen chest seals, OP. I have like I have one inside of my gym fanny pack and stuff. I have literally 2 or 3 inside of my backpack right now, and I have 2 more inside of my med kit or my belt and stuff. So like whenever I go to the range and stuff, you know, and like that's how much I like these things, dude. They're like so compact. You can't even tell they're even there, dude. It's so cool, yeah, you know. So now we move over into the SAM Splint, bro. Hold up, wait a second. Now I'm gonna go and talk about some stories, but before I get to my stories, I gotta get to my boy Yoda over here. He says, yeah, that's true, but what would you say the most common type of injury was when being in the field for you? The most common type of injury, good question. Mostly medical emergencies. You won't believe it, guys. Mostly medical emergencies. Grandma is not having, didn't have her glucose inside, or or grandma didn't have her sugar levels checked and stuff and everything. And so this is also when I say carry some, some of these, what do you call these? Electrolytes, I call it electrolyte powders right here. And so you get one of these tiny little packs, dude. These things, I'm going to actually buy some more of these things, but you can definitely get some of these electrolyte powder packs, like in these straw forms, dude. And so, powders, P-A-D-P, powders, yeah. Electrolyte powders, packs, like packs. The tiny little packets, dang it. These things, yes, finally, I found a Pedialyte. These things would work out. It doesn't matter what brand you would go for, okay? It really doesn't, okay? You can pack these things so dang small, dude. So dang small. Just add one of these inside of your backpacks, dude. They're not that small. They're not gonna take up too much of space. They're not gonna do anything. So this can help out with also like persons having glucose, thing. You know, I don't know how many times I fainted inside the gym just because my electrolytes are either low or my glucose was low, just because of lifting so heavy. And say, for example, if you're in the gym, right? Somebody passes out. You know exactly what's going on. That person is having low glucose. You don't give it to them. Never pour it into their mouth when they're unconscious. If they're unconscious, they're not breathing, they don't have a pulse, CPR immediately, you know? And so essentially, the thing is, once they get back up and they start like saying, "Oh my God, what's going on?" and whatnot, you give them some water, put some of that electrolytes inside of there, and stir it up and everything. Give it to them and allow them to be able to get those electrolytes that they need. Because the thing is, that's the thing that's going to help them out the most, And so the second most possible, another second most common thing you're going to go inside of. But what I could say, Yoda, is that you're most likely going to get into a car crash. Like, not you getting into a car crash, but most of the time, Americans in general would get into car crashes. And that's mostly because we don't teach our people how to drive defensively. We don't do that in America. And it's a sad reality that we live in. We focus on so many, I could say useless stuff, and that, say, for example, like in school, we learn about calculus, and I never used calculus in my life, dude, okay? So that's kind of what I'd say and stuff. So that's when all these little, these things come in handy, just in case. And especially, say, This is when I come into the Sam Splint, because after that call, not after that call, but after Halloween, I realized that I ran into a car crash in the middle of the intersection to the gym, and what if that person had a broken bone? I have to render aid, you know? And so essentially, like, when seconds matter, we are minutes away. We as first responders are minutes away, you know? And so that's when these Sam Splints come in handy. And that's what I love about Sam Splints. They're super useful and stuff, dude. And, like, I'd have to show you guys this, okay? You see this? You gotta do this thing. So, yo, what's up, Blue the Wolf? How are ya? So, yeah, you're not wrong. Yes, sir. So, that's kind of like the one thing that a lot of people be thinking, like, you know, oh, man, I'm coming from a guy that loves guns, dude, okay? I love guns, you know? And I be thinking about the most wildest things, like, what if this sort of bad guy happened, or that sort of bad guy were to come inside, or say, for example, a mass shooter were to happen. I have my gun. What type of tactics or anything I can do to neutralize the threat, assess the situation, tie that guy down, and render aid on innocent civilians and stuff. That's the sort of things that run into my mind. But let's be honest, dude. Most of the time, you or somebody else is going to get into a car crash. You're not going to be ever going, there's like 1% chance you're ever going to run, probably even a 1% chance, 0.5% chance you're going to ever run into, say, a mass shooting. And if you really look at the statistics of these sort of things, like, they're really, really low. Really low. Despite how the media wants you to think how common these things are, they're extremely low. And that's the thing. And so I don't want to go into how to mitigate this sort of thing and all that sort of stuff, because that's not the type of stream we're inside of, you know? And I'm glad to hear that you're doing good, Blue the Wolf. I'm glad to hear. So that's when we come into the Sam Splint. I remember when I went to a call. And I think you guys also seen inside of my shorts where I've talked about was old lady. She fell down because of walking her dog. She fell down into the ground inside of our local parks and snapped her forearm in half. It was just a normal day, dude. It was a normal day until she fell down and snapped her forearm. She was just minding her own business until her dog does what the dog does, you know? And so that's when the Sam Splint comes in handy, you know? And so you can be able to do something like this. And going into chat, Yoda, he says that you ever have like a moral dilemma, like when dealing with a drunk driver? Dealing with a drunk driver, I have never dealt with like a drunk driver yet. Not yet. Mostly because like most drunk drivers, you know, I could see, like, I have kind of like a soft side to like drunk drivers, but also like a hard side to drunk drivers, especially when they're not trying to be compliant and everything. They're not trying to be nice and everything, or trying to be following orders and everything. Then I get kind of like on that side where I'm like, you know, officer, just arrest them, you know? And if I was a police officer, if somebody's going to put up a fight about getting arrested, you're just going to get booked into jail. You're not going to get out of it. So if you're going to be like, you're going to be a little bit more nicer, yeah, you're going to spend some time in jail, but just remember that being drunk and driving, you're not only risking your life, you're risking other people's lives on the road. If you have your family, oh my God, dude. Another one thing I can say is there's this one story where this one guy actually he was driving his family while he was drunk. Both the husband and wife was drunk, and the child was in the back seat. He had buckled up and stuff, and a day before he got into a crash. That kid, he was inside of a police training that says always buckle your seatbelts. Both his parents died. That's how sad it is. That's why I kind of have like this. I have a soft side for drunk people, because like drunk drivers and stuff, because most of the time when people really drink and drive and stuff, these guys are probably most of the time they're like depressed and stuff, and I understand what they're going through, you know, and it's kind of hard, you know, but when you gotta understand that you're not only putting your own self in danger, you're putting other people in the streets in danger. And there's another drunk driver where well, it's not a drunk driver, but it was another situation where a person was hotboxing a vehicle in Arizona, and this is where one of my my instructors, he told me, and he's a police officer and stuff, and he told me that she was hotboxing with her friend in Arizona, driving 50 miles per hour in a 30 zone, right? And at the time, this is like in the early 2000s, where they like drink, smoking marijuana is illegal. Okay, I don't even think it's even illegal inside of Arizona either. Still, I don't know. It's specific areas, but whatever the case is, this person, these guys that was hotboxing, didn't notice this person running across the street. They hit the person. That girl, she was running across the street, flew over the top of this car. Okay, I'm gonna give you a car example. Let me show you a car. It's a sedan sort of thing. Okay, I'll catch up to Chad in a second. I want to be able to get my thought through real quick. So let's say this is a sedan. Okay, it's a small vehicle. Why is it all these expensive cars, dude? Just find me a 1900 vehicle, 1980s vehicle. Yeah, something like this. Okay, this is a small car. So the lady, her legs hit the bottom of the car front, right? Flipped over, literally her torso went inside of the vehicle, chopped her in half, and her legs flying off the top of the vehicle and laying over inside of the area 40 feet away. She died. That's what we're talking about. Those people that killed that girl. Number one, vehicle homicide is about 8 to 12 years in prison, depending on where you live. Inside of where I live, it's like about 8 to 12 years in prison. Okay, and hotboxing and marijuana, definitely in my state, absolutely not permissible. You'll go to jail for like several months or a year, several years or so. And driving 50 miles in a 30 zone. Done. That person, she was booked for like 30 years or almost close to 30 or 40 years in prison or something. I don't know, but they have put the most extensive sentence on her because they literally chopped this lady in half. And they was hotboxing a car. They was basically driving blind. And that's how bad it was. And I seen the pictures myself. I seen the inside of her torso, her gruesome face that she had inside of that vehicle, laying next to the person that she was unconscious by the driver, and also inside of her torso as well. If I've ever seen kidneys inside of my life, I've probably seen it right inside of her legs itself. It was a gruesome scene, dude. Oh my god. And the crap don't leave your mind either. That's the reason why I hate gore, because I can't get that crap out of my mind, dude. I try to stay as keep my tongue leveled and stuff, but damn, bro, it's just like, it's terrible, dude. Oh god. But anyway, I'll catch it to chat now. So even if you have other people in the car, that's worse than having one person. Absolutely, man. And you know what's even worse? You being the drunk driver, you killed the whole family. And you're going, you live with the misery, knowing that you killed somebody's whole family. And that's the worst part, man. That's the worst part. And Yoda says, yeah, man, I can't do gore. She'd be messing me up. Exactly, bro. Exactly. It's just some messed up crap, dude. And so that's the thing, dude. And so, that's why I've always had this sort of mentality of being able to protect and serve and everything and stuff like that. And then on top of that, you would be so surprised if the people in society itself were to be able to help each other out. It would be able to help not only first responders in mass casualty situations or natural disasters and stuff. We would be so much more well equipped, because the thing is, neighbors have medical equipment. Family members. The whole city has medical equipment. Not just the hospital, not just the police department, not just the fire department, draining out all of our resources, but the whole city itself being prepared for the worst. And when the worst happens, we're able to save lives. And that's the most important thing, And that's also this is also where we're going to go into Sam Splints, is where Sam Splints can be It can be like I said, where that lady, she was just walking in the park and her dog pulled her down and snapped her forearm, right? You just like have one of like these Cobans, or you could have like the Israeli bandage that I was talking about, or you could have like the compressed gauze, not the law enforcement hemostatic agent gauze, because that's $40. You don't want to throw that to the wind, you know? You're going to wrap this up. You're going to keep their arms stabilized, you know? And you'd be able to like keep their arm and everything proper. This the SAM splint also go for, let me go ahead and SAM splint. This thing can also work for, like tibia fractures. Okay, I don't think they show it right here. Okay, but this thing's pretty big. Okay, you're gonna have to. You can mend this thing. You can fold this thing. You could get the orange one. You could get the gray one. I don't care about color. I just gone for the orange one because orange just looks more professional to me. But you could have one of these things. These things are awesome. You could use this thing for like a tibia as well. When you do use it for a tibia fracture, say for example your friend fell down like let's say he fell down a small little cliff, right? Or he hit his leg somehow on a rock and it snapped his tibia in half. You could be able to fix that. You could be able to fix that, guys. I don't know why am I moving back into my seat? I don't know why. But this thing is another very life-saving tool. You could use this thing for it, and it's just super cool, dude. I'm gonna keep the. Let me take a screenshot of this. So, and then I'm gonna have to take me a pee break real quick because my God, guys, I drank some water and I'm drinking water like an alcoholic. Oh God, the only thing you guys should be able to like be worried about is to drink water. Don't forget to drink water and stay hydrated. Oh man. So there we go. Now, anything else I have forgotten? Not by the looks of it, but I'll be right back in a few seconds, guys. Just 1 second. Oh, look at that. I forgot about turning on a video. Let me turn on a video for you guys. Let's do Minecraft. Let's do Minecraft. One of my previous Minecraft. There you go, guys. I'll be right back. Let's see. So, how long is the stream? The stream's gonna be about like probably 2 hours to 3 hours long. So yeah, hopefully you guys do enjoy the 3-hour streams. I could be able to make content out of it. You know what I mean? I could be able to make content out of it. What's up, boys? How are you? You guys are gonna attack me or something? I could just be bing chilinging here, or what? So the events I have interest is request that requires an SQR. What is it? SQT. Sorry, SQT, which is a test on medical stuff, and you pass the test by being the top 5 out of the country. HOSA is a club. Abbott's Health. Medical. Ooh, that's pretty cool. So you're trying to get inside of medicine as well? That's pretty cool. That's pretty cool. That is super cool. Nice, nice. So hopefully you'll be able to get in that top 5. I mean, you seem like a smart kid, Board, so I'm gonna... Ah! Excuse me. I'm gonna go over here. You guys can't stop me. What are you guys hiding over here? What are you guys hiding? What are you guys hiding, huh? I want to see what are you guys hiding. Oh my God. Oh, or AKA clubs that future med students. Oh, go to. I'm not taking it, but the SQT requires events are so good. Hey, if they're super good, you could get some experience and stuff, and then you could get some pretty cool stuff and whatnot. You could get some knowledge and stuff. I'm gonna have to just straight up kill these guys, dude. These guys are getting in my way. Why are you guys throwing me around? Like, I don't want to kill these guys. What am I gonna gain from killing these guys? Like, what am I gonna gain from killing these guys? I don't know. What am I gonna gain from killing these guys, I don't want to kill these guys. They're not attacking me. They're just throwing me around and whatnot. Like, these guys aren't killing me. Why am I gonna attack them? Oh, he's gonna throw them. And they're pretty weak just to speak of. Yeah, talk about... Oh, I'm back. Oh, look at that. I'm back. So now we move on to the next subject. How is everybody doing today? How is everybody doing? Okay. Yeah, I only like. Well, we got only one person instead of chat. How's that one person doing at least? Okay. So now we move on to the next subject. You know, now we go into tourniquets. Okay. Yo, what's up? Hey, my boy Yoda chilling out. Let's go. Nice. So tourniquets. I don't even know how to spell a tourniquet, but that's okay. Nice. I need to get some Siege. Oh yeah, you do, bro. We gotta play some Siege one of these days, dude. Oh my God. We gotta play it. Oh, fine. Hey there. Well, hey, at least we got 2 people in chat. Look at that. At least somebody. We got some people that are actually interested in saving people's lives today. Look at that, guys. Oh my God, bro. That kind of warms my heart, guys. That warms my heart. Oh my God. Now we come to one other expensive tool, the cat tourniquet. Now, guys, you're probably sitting there wondering, why a cat tourniquet? What is it for and what do we do with it? Now, this thing's the most effective tool I could say. A really effective tool, and matter of fact, some even go as far as saying that it is the most important, what is it called, tool. You know, because the thing here is, if I could find a demonstration of the tourniquet use case, I want to see a demonstration, okay? With some, yeah, we'll use this one, okay, guys? We want to show some scary stuff, like I said, okay? We're going to see some gory stuff today, okay? You see this? The cat tourniquet, guys, is the most important thing that you could add. Well, it's not the most important thing like I was emphasizing. Well, it's important. It's important. It's like important as everything else. But say, for example, open fracture, okay? And there's a, I smacked my microphone. There is a like situation where you're going to be able to, like, you're having a arterial bleed. And literally it will be spurting, just like how this water is. It's literally spurting to the blood pressure. Every time, you know, if you go ahead and take your pulse, or on your, what is it called, your, right on your, kind of like your forearm, you know? Go ahead and take your pulse. Every time your blood, your pulse is there, that's how your, what is it called, how the blood is going to spurt out of that wound, okay? It's going to be spurting out, and it's going to be this really red, bright red blood. And so you can cinch this thing down, and this is another, like, this is another type of tourniquet. There's so many different tourniquets out there, but what I would recommend is get a cat tourniquet, and I would say about approximately like 1 or 2 of these things. And so, like, I would say about get like 3 of them before you go and get, say, for example, I'm going to go to T-Rex Arms website. You got, like, excuse me. You have, like, the TMT. Oh, my baby bird. What's up, baby bird? How are you? You're just flying around. So you got the TMT one, which is like, it's a pretty large, thick tourniquet, and it's really useful, you know, it's really useful. But the thing is, we are trying to focus on taking care of space. Then you got the SAM XT, which is about the same as the SAM tourniquet, but it's kind of like the SAM tourniquet, but it has like more like these loopy things, sort of things. But hey, it gets the job done. If you want to get one of those, most people would go and get those sort of things, but for the average person that would go for it, I would recommend get a SAM tourniquet, because the thing is with the SAM tourniquet, is that it has been combat tested in Iraq, in in Afghanistan, inside of multiple like raids and stuff for like these high value targets, and also these these also really dangerous threats and stuff. They've been used on those sort of things. So essentially they are very effective tools, okay? So that's what I'd have to say is definitely get one of those things or 2 of those things. I actually need to get 2 of those things inside of my backpack itself, because, you know, you can't have too many, okay? I have like 1 inside my backpack. Yeah, I have 1 inside my backpack at all times, but I need a second one though. Moving on, and also you don't really need to get either black or orange. Don't get the blue. Blue is for training purposes, okay? You could use this as an actual tourniquet, no crap, okay? Not saying that you can't use this one as a, what is it called, as an actual tourniquet, but the thing is, the more you use it as, like, say, training purposes, you're going to damage the fibers and everything, to damage the efficiency and everything, so you could get a trainer tourniquet. So if this thing ever to snap one day, but which probably never will, but if it does, it's at least a trainer's tourniquet and not the one that you're going to use to save somebody's life. Okay, so if you want to learn some more about that, I would recommend you guys to go and look at the Prep Medic, which he has, like, what is it called? So many type of like stuff. If you really, really want to get something smaller and stuff, get the Soft T Wide. The Soft T Wide is what I carry inside of my fanny pack for the gym and stuff. And this is mostly because of how, like, collapsible it is, okay? And that's the most effective thing about it, okay? But it does take a little bit of learning to understand, like, how the thing works, but it's not too hard, like rocket science and whatnot, you know? So definitely get a tourniquet. So moving on towards, let's see, we got everything that we would need, basically have what we need. Now moving on from this, I think is what we could say. Let's see, we got everything, basically everything that we need. Oh, also, I mean, you could add some protein shakes if you want to. I mean, not protein shakes, a protein bar inside of your backpack if you want to. It's more for me, I usually do that. But now we have everything, okay? This is like, you could double or triple your amount on this. Oh yeah, I forgot, emergency medical, what is it called? Blankets, emergency blankets. Emergency blankets. Okay, not a fire blanket, an emergency blanket like this, a thermal blanket, okay? This thing, oh my god, this thing could be useful inside of, like, say for example, you're out in the cold, you could keep this on you, and you could, like, even hiking or camping, dude, you can use this for, okay? You could use this for, like multiple purposes. It's not even for trauma either. It's not only for trauma. But do understand you want to keep your patient warm to prevent them from going into decompensated shock, if not irreversible shock, because the platelet aggregation is far more effective when that patient's warm. So keep your patient warm is going to be the most important thing, and also don't strip them naked when you do put this thing on them, okay? You gotta keep that, you gotta keep their blankets on them, like keep their jacket on them, keep, what is it called, like their, you know, any warm things that is going to be on there, because this is going to just, it's like an aluminum foil, okay? It's just gonna keep the warmth in. That's basically all it's gonna do, okay? So that's what it's basically supposed to be doing. So one of these things, okay? You could get, like, I have like 3. I have 3 in my backpack, okay? I'm not only thinking about myself, but like other people as well, so I just keep 3 in there, and it doesn't take up too much room and stuff, so hey, it works, you know, it works. So I'm gonna show you guys this. Well, you guys were seeing this thing the whole time anyway, so now I'm gonna show you guys this thing. So there we go. Now we've got basically everything that you need, okay? So shears, I like making the joke of whenever people, they say, oh, why you carry shears around? Because I carry these Raptor shears, which is like these $90 things like I showed you guys earlier. Don't buy Raptor shears, guys. Don't waste your money on Raptor shears. But yeah, I got it as a gift though. So essentially, I just simply make the joke of, these things are to make people naked. That's simply that's what it is. What about a sword? No, don't do a sword, my man. Yeah, a sword is like, it could get the job done, but the thing is, the shears is designed to prevent cutting the person. You see that blunt edge? It keeps that patient safe. So that thing would be sitting, let's say, I'm gonna cut open the shirt of this guy's, what is it called, shirt. So I could be able to see, like, I put that thing on his, like, you know, on his chest, and I could go right through. And so that's where it is, you know? So I would simply say, yeah, definitely, these things are really effective and everything, you know? So now we'll just go ahead and add all these things up and show you guys how much it is going to cost. So let's see, this is going to be $32. This is going to be, like, I'd say get a box of, what is it called, gloves. So that'll be $11 or $12 basically, $12 US. And then If you're in $10 for the NAR wound packing gauze, $14 for the same splint, $8, which is for this one, okay? And then you get $15 for this one, okay? And then we go a start for $10, and then you go ahead and get one of these ones. Oh, or night vision goggles. Night vision goggles, you could go ahead and get night vision goggles if you got the money, my man. But it would be mostly for night vision goggles would be great for hunting, and also revolting against a tyrannical government. But other than that, that's basically what it is good for. These things, you could get them at a smaller packaging. I think you get them in, like, you could go down to like Walmart or King Soopers or whatever, like Walgreens. I don't even think Walgreens even have it. But you could go there and probably get these things for just $10. They're not even $26. Don't even waste your time worrying about that. And then you got this one, $7. Okay, so that goes up to a grand total of $184 or $85 for all of these things. And these things are life-saving equipment, guys. You don't need to buy all of these at the same time, okay? If you were to go, and I'm going to make a like a little thing where I'm going to start off with, if you're going to go and start off anywhere, start with these ones, okay? These ones, I'm gonna make my brush bigger, okay? Make it thick and chunky. I like them thick. I like them chunky, round. Like my paintbrush. So look at this, guys. So, oh my god. Okay, where did I go with that? So, there you go. Pocket mask. Start off with these ones, okay? Then we're gonna go for a yellow, okay? We're gonna go for yellow. We're gonna go ahead and start off with, then you can go ahead and, oh yeah, also we can't forget about gloves. Don't forget about gloves. Nitro gloves, they're just OP. I love my nitro gloves. I actually have fentanyl protected nitro gloves from the ambulance, and I love them because the durability is lovely and stuff. You could go and search those ones up if you want fentanyl protected nitro gloves. Then definitely go ahead and get, excuse me, these hyphen chest seals. A hyphen chest seal, hold on, basically get these ones, because I'm going to start off with cheaper to expensive, okay? These things, like, you can get these in, say, for example, you could get them, like, probably, like one at a time if you want, or two at a time. Like, you could get one of these ones, and then this one, and you could leave this one out for later. Or you could go ahead and do, like, this one, and this one, okay? It's up to you. It's up to you. And then, moving forward, we would definitely also get, oh yeah, also you want to get this one too, okay? Don't forget about this. Second most important. You got to make them naked, okay? You got to see their chest and stuff. You got to see it. You got to put that thing there, okay? Okay, so you get this thing, and then also do understand you want to respect the privacy of that patient. So you want people, when you're going to cut somebody's shirt off and stuff, keep people away, okay? Just understand, keep them away, dude. You do not want the bystanders to see it, because it's going to be embarrassing for the patient. Treat them the way you want to be treated. And if you're kind of like, if you like being a thought and you like to show your body and stuff and titties and everything to everybody, then just understand that other people don't like that, okay? Not everybody likes that, and not everybody thinks that way, okay? So that's one thing. Also, one of the other most important things is this thing. Also get this thing. This thing as well. This is just not that expensive, okay? Just carry a few of them inside of there. Probably even save you as well. And then we got the other ones, which could be done, like, probably later on and stuff. You could get one of these things, you know? And so these things you can all buy, like, okay, I want this one, then I'll buy that one, and I'll buy this one, and all it together, or whatever you guys want to do. So that's what I would say is the proper way of buying these things, because you don't want to just, if you guys got the money to spend $200, go and do it by all means. You're gonna save yourself time and money, and also lives as well. But you're gonna also be able to do is, like, you can be able to build this sort of thing out and whatnot, you know? And I've been carrying medical equipment for, like, close to, like, 2 years now, man. I've been carrying this stuff for 2 years now and been building out on this stuff. I haven't used it once, thankfully, but if I ever were to use it, it's better to be prepared than what is not prepared. Better to have the tool than not. Better to have it when you need it and when you don't. Then, hold on, wait a second. Better to have it when. Oh God. Better to have it when you need it than need it and not have it. That's what I'm trying to say. That's what I'm trying to say, guys. So definitely do that. So moving on. We already got this sort of thing done, so we don't need to worry about any of this sort of stuff anymore. Okay. So we got our tier list, boys and girls. Okay, we got our tier list. Now I'm gonna open up my live stream because I need to see my chat real quick, guys. Also, if you guys are enjoying, go ahead and smash that like button, subscribe, and I would appreciate it, guys. Thank you very much. Uwu. I gotta throw in that uwu all the time, dude. I just absolutely crack people up, dude. I love doing that so much. So I got some stuff here, okay? I'm gonna go ahead and pull up all of these right here, okay? I'm not gonna mess with my V-band stuff. I need that stuff. These are already probably pre-made medical kits, okay? And these ones, yeah, they're all pre-made medical kits in which you can definitely get. Excuse me, little one. Excuse me, little one. Calm down. This little guy over here is just making noise, bro. So let's go ahead and put this tier 1 concealed, which this one is probably my favorite one. I'd actually say I got biases, okay? I got biases for lay people to be able to get really good equipment, dude. Move this over here, move this one over here, and oh, I already have this open? Oh shoot, I already do have it open. Put that here. Okay. Now we're going to move on to our tier list, boys and girls. And today we are going to go ahead and do this, okay? Okay, good. Now, everyone, now we must focus and pay attention now. We got really cool medical content, and this is why I say really cool medical content. And this is probably not going to take that long because your boy know how to work fast. So, Skinny Medic has made this really nice trauma kit. Again, $165 or $170. You got pretty much everything inside of here. You got the trauma shears, you got the black Sharpie, which, dude, black Sharpie, guys, if you have one, that's none. Two, that's one. Okay, that's how I am. I have literally a Sharpie like on my desk, at my bedside desk. I got a Sharpie in my, what is it called, or my belt. I also have like a Sharpie I'm gonna add inside of my later, probably I buy another 3-pack or something, throw it inside my bag and stuff, because the thing is, when you need these things, you're gonna need these things, okay? They're very, very important, okay? Very important. And I sure hope this thing, okay, it's 1 hour, okay, good. I'm thinking it's missing out on a lot of stuff. But this guy decked it out. Skinny Medic made a really cool trauma kit. You could tell, like, you got basically everything that you need inside of here, and it's just awesome, dude. I love this guy, what he did to it. Even added the nasal airway, dude. I don't even carry that, bro. But hey, if you want to carry a nasal airway, do it. Also, if you haven't, like, you have to put it inside their nose, right? And so essentially, stick it in their mouth, put it in their nose. That's how we do it, okay? Yeah, that bird tweaking. Yeah, exactly, for real, bro. He's loud right now, bro. What are you trying to? Are you trying to take over my stream right now? He's trying to take over my stream right now, guys. Jeez. Oh my God. So, moving from here, so just 1 second real quick. Okay, so he's got something to say. Exactly, bro. He does have something to say right now, bro. Oh my God. So there we go. So we have like all these sort of things. Bird said yes. Exactly, bro. So essentially that we have the compact hyphen chest seals, what I was talking about. The OLES 4-inch is like, it's basically another ETD, like I said before, on like previously. Like you see that one right there, right here. This right here, it's basically like that, with just like this, like dip circle thing on there. It's pretty cool, though, you know. But anyway, SWAT T tourniquet, which is like the SWAT T is kind of like, I think. Let me see the SWAT T. Oh, that thing. This thing's pretty cool. I like this thing. This thing we actually have on the ambulance. We've never used it, thankfully, or anything. And we never used our tourniquets. It's just like trauma, you don't really take and stuff. But you get to have these things. You can be used as a trauma, you know, it can be used as a tourniquet, and it also can be used as a, like, an occlusive dressing or something like that, you know? And it's a pretty cool thing. It's cool that he actually added that sort of thing in there. So EMS rolled, guys. You got the compressed, guys. You got the gecko tape, which I actually have, like, but I got, like, what do you call those tapes, guys? You got, like, I got Co-Band and stuff. Gecko tape is a pretty good adhesive dressing bandages and stuff. It's like a tape that is great, dude. I like it. I like it a lot. And then you got the NPA number 28, which is about, like, it's a pretty small size, but it's also pretty big enough for the most adults that you will put this in here. So, okay, for the NPA, for you guys to know, do not ever add an NPA, which is what, if you guys never seen one, I'll show you guys what an NPA really looks like. An NPA, which is this thing, do not ever add that thing into a person that has facial trauma at all, because you're going to injure, what is it called, the person. You're going to just basically, you can shove something down inside their face even more, and you don't want to do that, okay? So don't put an NPA into somebody's face like that, okay? Survival blanket. That's basically what I've showed you before. 2 pairs of large non-latex gloves, which is great because I love the fact that he added 2, because most of the time, if one goes down, you got a second pair to be able to, what is it called, you know, repair, like slip that bad boy on. When I was on the ambulance, I would carry 3 to 4, you know, 3 to 4 gloves with me at all times, dude, at all times. Nowhere I would not go inside of any scene without 3 or 2, like, gloves. And sometimes I even packed 4. I'd even handed some to my police officers and stuff when I was responding to one other scene where this one guy, he was having this massive seizure, dude, and so I gave it to one of the police officers. This guy was bleeding everywhere because his arm wouldn't stay steady when he was trying to put an IV in this guy. So yeah, so skinny medic patch, it's, oh my god, bro, I want to buy this just so I can have that skinny medic patch, dude. Look at how cool that thing looks. Don't lie to yourself, guys. Don't lie. Okay? It's pretty cool. I give this freaking S tier, okay? Freaking S tier. I love the skinny medic, what is it called? Content. These medical kits are awesome. Okay? So, trauma kits. Let's go ahead. Well, how bad was his seizure? This guy's seizure, he was on the floor, unconscious and everything. As soon as we started trying to, like, getting him up and everything, guy was tweaking. Like, he was, like, having, like, these tonic-clonic situations and stuff. And I was like, okay, we gotta hold this guy down. He was like his legs was moving around, kicking us and everything. We had to, and this was in my FTO process, so we had, like, 2 other guys. So not only I was on there, but also 2 other guys. And so essentially, this guy was kicking us around and stuff, and I had to sit on his legs. And the other, what is it called? And I was still jumping around and whatnot. I couldn't even hold this guy's legs down. One of and I was also holding down one of his arms as well. And then one of my other paramedic EMT partners, he was holding down, what is it called, the other arm, which my paramedic was trying to put the, what is it called, you know, put the, god dang, man, I can't remember. Put the IV in. This guy, he moved his arm in such a way that it messed up the IV, so now it couldn't, what is it called, get inside of there properly, and now he's bleeding all over the place. So it was a mess. It was a mess. So we had to use gloves and everything, and we always wear gloves at all times. Back then, you're not called a paramedic until you have blood up to your elbows, and now we're wearing gloves because we don't want nobody's STDs or bloodborne disease and hepatitis B, C, D at all. They could keep it to themselves. However they got it, they could keep it to themselves. Anyway, so this thing is also another really cool concept. It's kind of like a little bit larger and stuff, but you don't get all those Gucci stuff like they have in the last one, so I didn't really add that. I'm gonna add the ones that is kind of Gucci and decked out and stuff. So they got some cool stuff. Check them out. Links down in the description as well. Tier 1 concealment. Okay, guys, I love Tier 1 concealment. They got the best holsters. They got the best, what is it called, holsters of all time, bro. I like their apparel. There's actually some foam wedges I like using, man. Okay, what are we talking about? Oh, yeah, shoot. I forgot about, we're talking about medical content. Never mind. We're not talking about guns today. Dang, there's that bird again. Exactly. He's just singing again, bro. Oh, my goodness. So, moving on to the medical content of this bad boy. You see this one right here? The Tier 1 Concealed Combat Trauma Pack. This thing can be mounted onto your belt. This thing can be mounted onto your, mounted into your, like, you know, your backpack. This thing could be mounted basically anywhere, basically. I like it. You could even put this in your vehicle, which I don't recommend, okay? I don't recommend leaving guns or medical content in vehicles because there's going to be a time when medical content is going to be stolen out of your vehicle, and I don't trust leaving my medical content in my vehicle. But I digress. So, this is just absolutely great for lay people like you guys. Like, you don't know too much about, like, medical content and whatnot, you know? But these guys have added this really durable bag for it, right? So you guys could be able to use like this thing. Let me zoom into this bad boy. Look at that. Stop the bleed. Open the airway. Vent this. What is it called? Vented chest seals. And E to prevent exposure. Save lives together. These guys are awesome. It's about $205. I don't have money like that right now, but hey, that's fine, you know. But probably buy one of these myself because I want to mount this sideways. No. I want to mount this kind of like a vertical fashion for my belt, so it's not sitting on my back, because whenever I sit down, I don't need to worry about it. But hey, it is what it is. But anyway, we have our Combat Trauma Pack. We have our Cat to Gen 7 Tourniquet. Emergency Elastic Wrap, which is Emergency Elastic Wrap. What the heck is that? Hold on, wait a second. Oh, you're talking about Coban. Oh. ETS, yeah, that's not Coban, but it's ETS. Never mind. Not ETS, ETD. Then you got your 4-inch click clot wound packing. You got the trauma shears, twin pack vented chest seals, NAR pressure bandages, which is pretty dope. And then you got the this hypothermia blanket to keep them warm and stuff. Medical gloves, mini duct tape, which is pretty cool as well. Black Sharpie. Okay, nice. Instructional cards for the lay people. And Chem Light. Bro, the Chem Light is awesome. You know, the reason why I like the Chem Lights is because you can mark areas in the dark and also get into like information and stuff. And if it's green like this, you're gonna get attention and stuff and whatnot. So I like the Chem Light idea, okay? Probably start carrying something like that. But, you know, since it didn't have as much... Whoa. We don't want to go to training right now. Since it didn't have as much as... Like, you know, we're going to minus out the skinny medic patch because that was super dope of them to add that. But we got 12 different items. This one has like 1, 2, 3, I don't even understand Spanish, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Well, about 11 or 12. I'm still giving this one an S tier. It's great for the lay person. Heck, I would even buy it. I'm not even a lay person. I like this thing. I love it. It's so dope, guys. It's so dope. Well, I may even keep on closing this stuff. Just keep it open. Now we're moving on to one of these T-Rex arms. Oh my god, I love this company. So, T-Rex Med 1 kit, which is kind of like what you can put inside your Med 1, which is basically this bad boy. I have one of these things. I wish I got it in... I actually did get it in brown. Never mind. I like brown, okay? They don't have... What? They don't have Ranger Green? Oh, they do have Ranger Green. It's just out of stock. Okay, anyway, got distracted for a second, guys. They got Burn Tech. I'm not a really big fan of, like, this sort of content. Like, look at this. I don't like this tear away sort of thing. I like how these guys have, like, this zipper sort of thing, so you don't throw out everything, and then you got this open pack and stuff. So that's just my gripe on it. I wish I could tell, you know, I could actually email them, give them an idea. Like, as a first responder, I honestly feel like there's a better idea if you were to just have a zipper sort of thing, like Tier 1 concealed, like something similar to a Ziploc bag, you know? So you got the burn tech dressing, which I didn't include the burn tech dressing mostly because you're not going to use it on somebody that is going to have anything that like a 2nd-degree burn or a 3rd-degree burn. And hell, God forgive if it's a 4th-degree burn. God help that person because they're done. They're done, okay? If I've never seen a 4th-degree burn, we'll just say this. They go through both the skins, underlying tissue, and even the bone and muscles as well. I'm not showing you guys the pictures because it's really graphic, okay? I don't want to show that stuff. You go and search it up if you're interested in yourself. Burn victims are like scary, dude. It's just so scary, but yeah, burn dressings is really good for 1st-degree burns. And if most of the time, if you're gonna deal with a burn victim, you're gonna use like again let me show you guys this. You're gonna use this bad boy. You see this right here? This bad boy. Dry sterile dressing. That's it. Dry sterile dressing. Wrap it. Send them to the hospital. Because the thing is, also you're gonna if their clothes is stuck onto their body, don't pull it away. Do not pull it away at all. Just leave it as is. And I believe in first response we we would like put shears on, and we cut the pant like around the surrounding area and whatnot. But most of the time we just leave it alone. I don't think we're supposed to like wrap or anything and whatnot. If their pants, for example, is like glued onto, like burned onto their leg, which literally does happen, guys. You guys got another PTSD or like another fear factor to worry about now. About having pants on that's probably going to burn and stick to your pants now, so don't get into a burn or a fire. So yeah, compressed gauze, which is good. ETD, okay, nice. Got the hyphen chest seals, and then the law enforcement combat gauze, and then nasal airway. Now, I would say this is a more cost-effective way of doing stuff. $75. Most people don't have $200 to toss to the wind. I'll give this an A. I give this an A because, the more they add inside of there, I'd probably say remove burn tech. But then again, if you're at the range, those brass, you'd guys be surprised. The brass gets hot as hell, dude. It touches the skin, bro. And I don't think you're gonna get burned with burn tech, having to use burn tech and stuff, guys. I just don't see a reason why to have burn tech inside of there, besides for a 1st-degree burn, which most of the time may happen, but that's up to you if you want to add that into your kit and stuff. So iTrack, they have this EDC medical kit, which is about $60. I like it. They got the quick clot. They got the elastic wrap, which is flat. Elastic wrap. Let me see what the heck is this. Hold on.
Hemostatic dressing used.
Got the hemostatic dressing, and then you got the hyphen chest seals. Got the this is the elastic wrap.
Really see that happening with these. So that is one of the reasons that we changed.
Oh no. But take it back.
The ETD is very sticky, so it's a little bit difficult when you apply. And then the weave of the ETD is actually very loose. So when you start to pull it apart and apply pressure, when you are wrapping a wound that you have packed, it starts to come apart kind of prematurely. And we don't really see that happening with these. So that is one of the reasons that we changed that.
Okay, so it's like an ETD, like you said, okay? Just wanted to let you guys hear that, so you guys be like, so you guys don't be like confused and stuff, and be like, okay, why is that? So again, when he was also gesturing, like pointing it to his throat, you're not wrapping somebody's throat up, okay? You're gonna get in there, you're gonna obstruct their airway and stuff, and we don't want that, okay? Don't do that. The elastic wrap is great for being, small and flat and everything, it's kind of like, again, like the SAM splints and stuff, like the SWAT one, something like that. So this bad boy, basically wrap it 1 or 2 times, then fold it over that wound, that pressure site, and then wrap it again and tighten it. You want to cinch that bad boy down. So I actually probably should, add one of these things into my kits because, those ETDs are huge, guys. I'm telling you, if you get one of those things, you'll be sitting there like, dang, man, they are actually pretty thick and stuff, So, moving on. Hyphen chest seals and a pair of bear claw nitrile gloves, which is awesome. And they're a pair of mediums, which I like to wear because mediums just fit so snug on my hands. So this one, I'm giving it a, what do you think, guys? I'm thinking B. I'm thinking B or A, because A for effort, but B for basic necessities, you know? It's just getting by, okay? It's just getting by, you know? I'm just gonna say that. It's just getting by. Then you got the extended medical pack. Bird be birding. Yep, exactly, bro. Now all of them are making yelling noise. Look at that. Yeah, I know, Noodles. I know, bro. What about it? He's just looking at me like, what the heck are you talking about, bro? Oh my god. So this one also, I'd say, is probably a pretty good one. You got like all this stuff. You got, this is an extended bear. And also, look, the NPA comes with lube. I'm gonna be honest with you guys. I'm not gonna use lube in the field, okay? I'm not using lube in the field, but I'm gonna give it an A for effort for all the other stuff. But lube in the field, it's a water-based lube where you're going to put it on the NPA, lubricate it, and then stuff it down their nose, you know? So, yeah, it could be pretty useful, you know? But I'm just gonna do the simple way, stick it in their mouth, because most of the time, if they're gonna be unconscious and stuff, and they're breathing very shallow or something and whatnot, you're going to do the head tilt chin lift. You're going to go ahead and check for airway sounds. If you don't hear anything, put the NPA in there, reassess and stuff like that. I'm going to just put it in their mouth, put it in their nose, and leave it like that because, you know, I'm not going to fiddle around with that stuff, you know. Just that's what we do in the field, okay? That's what I actually did on that one seizure patient, guys. Oh, boy. Now my favorite guy, oh god, War Poet Society, the guy, John Lovell, the guy who designed my gun itself. He designed my gun, but, you know, he designed it like the War Poet MR920, if you guys aren't familiar with the MR920. The Shadow System MR920, oh my lord, it's looking super sexy. It's better than a Glock, though. Why am I looking at guns inside his stuff? Oh my god, I want to just show you guys this. This guy, he made the War Poet. Look at how beautiful it looks, dude. It looks so beautiful. Oh my god, bro. I look so sexy. I got the threaded barrel, though. I like the threaded barrel. Oh, yeah. Slap a suppressor on that bad boy one of these days. Oh, heck yeah, baby. Look at that. Oh my god. It's so beautiful. Yeah. Anyway, we're going to just leave it alone. Okay. Ankle medical kit. I bought one of these, okay? I'm gonna give this, I'm immediately putting this, okay? Hold on, where is it? I'm putting B. B for basic, okay? Why? You're probably sitting there, Fuse. Why? Here's the problem, guys. This thing is awesome and all. I tried one of these things, and I'm a guy that wear kind of like tight pants and stuff. I wear a little bit tight. It's not skin tight, guys. If you were, hey, I see you freaks back there. I see you freaks back there thinking, oh my god, Fuse, oh my god, he got the skin tight pants and stuff. Oh my god, no. Get that out of your mind right now, boys and girls, or whatever. Like, seriously though, like, the thing is, got them cheeks out. Hey, yo! Oh my god, bro. But nah, bro. Like, seriously, though, like, I have, like, it has a little bit of width. Like, there's a little bit of opening at the bottom of, like, they're athletic jeans, you know? They're athletic jeans. Blue Wolf, I know, bro. Oh god. Oh no. You know, so they're like these open, they're like athletic jeans, you know? They're a little bit tighter around the thighs, but a little bit loose and elastic and stuff. I like that. I love my jeans like that. And it's a little bit loose, but it's also tight enough that it's not like the husky pants I was grown around wearing. Dude, I freaking hated husky pants, dude. These pants sucks. Now, if you wear like husky pants and stuff, I mean, by all means, buy this thing. You can keep the medical kit around your ankle, yo. Why do I say yo? Like, you can keep your medical content on your ankle, and nobody, literally nobody, would blink an eye because you're wearing these things. I used to wear these things when I was younger, bro. I freaking hated it every single second of wearing husky pants. It was the most worst pants on existence. I hated those things. My God, I never will go back to husky pants. Screw those things, man. I like my athletic jeans. They're like these things. Athletic jeans, like these things right here. Why I keep on looking at my keyboard? I never look at my keyboard unless I'm on stream and stuff. Like, seriously though. Of course, my man has to flex his abs when we're looking at his jeans over here. Like, this is kind of like how I like my jeans, like a little bit baggy, but also a little bit tight. You know, it looks kind of cool. You know, and so this thing does not work with me. It looked like I freaking had like one of those criminal medical like monitors on my leg, and my mom was like, I don't like that. I think you should send that back. I was like, yeah, I think I should too. It did not look nice, guys. But look at how it conceals on John Level's leg so well, because he wears those sort of jeans and stuff. And now I know some of you guys are going to be like, you know, Fuse, you can just go ahead and, you know, just change up your wardrobe. Guys, look, you got to understand this. You gotta either you dress around your EDC, or you change up all your looks just for your EDC to look good on you. I'm the type of guy that dress around my EDC. Okay, I always like wearing baggy hoodies and like the sweaters and stuff all the time. Nobody's gonna know if I'm carrying a gun or not. Okay, so that's how I am. I'm not even going to worry about it. Or if I'm wearing business attire. Again, nobody's going to know because it doesn't print or anything. And even if it does have a tiny bit of print, like, you guys don't know. You don't even know who I am. You don't even know if I even like guns or not. Literally, people that looked at me was like one of our friends, he was like, you like guns? I was like, heck yeah. I can even go into the ballistics and type of calibers and all those sort of things, and what is it called, situation-based weaponry and stuff that I'd go for and whatnot as well. So, yeah, I love guns, okay? I love them, okay? And so he's like, oh my God, I never expected you to be so much into it, because I know your brother likes his stuff because he open carries sometimes and whatnot. I'm like, yeah, but that's him. He likes attention. I don't, okay? So this thing will definitely attract the wrong attention if you're like me and you wear like kind of skinny jeans and stuff sometimes, bro. This thing's not flying at all in my book, okay? So I'm giving this one a B, because it's not bad. It's not bad. It has the compressed gauze, it has the MPA, it has the elastic wrap. He has the trauma shears, the cat tourniquets, the nitro gloves. You got the hyphen compact chest seals as well. They're good. It's good. They have all the things that I would carry on my belt as well, you know, and also in my backpack and stuff. But it's not going to be it's not as efficient for people like me that likes wearing skinny jeans. And I know some of my friends, they do have they wear shorts and stuff, and it wouldn't work out for them, you know? And so, and then as well as on top of it, if they also kind of wear baggier pants, so it probably would work out for them. So I give it beef because not everybody's going to be able to wear this thing and conceal this in some fashion and whatnot. And I just personally don't see a problem with concealing what open carrying medical content, or even people knowing that I carry medical content. Unless if they're type of people to rob me and stuff, then they're going to have to put up a fight with me. Okay, so anyway, moving on to the next subject, okay? We got this one, okay? I'm putting this, these two. We're going to go and check these bad boys out. Blue Force gear. I have to buy some stuff from you guys, so keep an eye out, or my money. I got some things I have to buy from, what is it called, Blue Force gear itself, but it's not medical content. But we're going to check out this trauma kit, guys. These guys, they give you the essentials kit, okay, the quick clot, or the mini compressing, and the mini compressing, guys, flat foam tape, and hypothermia blanket. Bare minimum for the range, okay? Then you could go for the pro kit or the advanced kit. The advanced kit, though. Oh my god. Looking good, my man. But it comes with a needle D. Needle Ds, guys. We don't talk about the needle D. Because problem here is, do you know how to decompress somebody's, what is it called, lungs? Raise your hand. Exactly, you don't. Not even I do. And it's a paramedic level sort of thing, and or nursing RN level knowledge. And also, if you were to use this in the field, you're more likely to get sued for needle decompressing somebody in the field. Would you guys like to know a little bit more about the needle decompression? Go ahead and let me know in the comments, you guys. But you could get the belt mounted one, which is pretty cool. You could get the Molly mounted one. You could get the, it's $120 extra, so about $210. I mean, I'm giving this for like a lay person that possibly want to have something like this. I'm gonna have to give them like, I'm gonna have to say, I'm gonna give this probably a C, because you know why I'm gonna give this a C? It doesn't have as much. It doesn't have as much as, say, it does have the chest seal, got the mini compressed dressing. It also have the quick clot, and also have the nasal thing. But we're missing. Hold on, none of them had the CPR mask, so why am I even worrying about that? Let's see. It's missing the tourniquet, and it's missing the scissors. So, yeah. I'm not gonna have to talk about that. You could get the sheer hammock and everything. So I'm just giving it a top. I'm giving it a C, and knowing what this is, it's gonna be bulky, guys. It's gonna be like this massive little thing, tiny little compression. It's really small, right? But it's the width size. Holy cow! It's huge. It's huge, guys. I don't think I want to even carry that thing. But that's when this bad boy comes in. He's thick. He spreads the width. He spreads it out, you know? And so he's like a big boy, you know? He's a big boy. And so you see this, guys? Oh my god. Really cool. Got that pull tab system and everything. Let me drink some water. My throat is getting kind of rough over here. There we go. Okay, so this thing, emergency trauma dressing was with the 6-inch hypothermia blanket and everything. Twin twist wheel. Okay, twist wheel. But I'm giving this one. I'm sorry. Blue Force gear, but you're getting the C. You're kind of close to F, but you're adequate enough to be up to B. But you're also a C, because you're not as advanced than I want you to be, and also you don't have enough stuff that I want you to be. You're gonna just stick on a C. See, you're kind of like the other one, but just fat. That's all you are. That's it. Okay. Nobody having arguments today. Okay. I have spoken. Okay. Anyway, so IFAC, the IFAC WPS War Poet Society IFAC is gotta be. It's gotta be, my guys. It's gotta be my, like, kind of like my favorite one as well, because, you know, oh my god. If you look at it, it got the compressed gauze, right? It also comes out like kind of like the micro, like this. Ooh, what the heck is this? Ooh, I have actually yet to see this one. Oh yeah, so it does come out like similar to like the micro trauma kit, okay? Kind of like that one. It also have like trauma shears, which is kind of good. Cat tourniquet comes with, okay. Got the gloves, got the chest seals, got the elastic wrap, which I definitely need to add it to my backpack and whatnot too. No, not my backpack, because I have like those two other ones, whatever. But got the nasal airway and the compressed gauze. Where's our law enforcement of compressed gauze? Hold on, wait a second. Hey, yo. Responder compressed gauze. Is that like... Hold on, wait a second. Wait a second. You're missing out on the law enforcement of what is it called? Compressed gauze. Ah, bro. Man. I'm a guy. Okay, fine. I'm gonna give it to them. I'll have to give it to War Poet Society. It's $130, guys. That's a steal compared to, like, the Tier 1 concealed. or Skinny Medics one, okay? It's a steal. It's $30 less. You're getting a lot. Okay, yeah, okay, I know, but this is a little bit more bulky, but it does get the job done. So I'm gonna have to give this I'll give it an A. You know, hey, I think I gotta go. See you later, Blue Wolf. You have an amazing day, my man. Have an amazing day. So we're gonna go ahead and put this bad boy. We'll put him to an A. I like you, but I don't love you. Okay. That's how I am. Thanks, my man. I do appreciate it. I'll see you later, Blue Wolf. So, let's see. Now, anything else on our medkit pack listing? This thing right here. Oh god. We're going into the cool territory. Oh yeah, I forgot about the everyday ankle trauma kit for these guys. This one is pretty cool and stuff, but nah. With bleeding control, oh shoot, you could actually ankle holder only. Okay, but yeah, okay. You got cat tourniquet, bleeding, and a hyphen chest seals. Dude, I feel like this one is an actual F. This is an F, guys. This is an F. Hold on, wait a second. Got the compressed gauze, an NPA, elastic wrap, trauma shears, cat tourniquet, and the chest seals. Chest seals, gloves, the quick clot, and tourniquet. We're talking about 4 things. This one, 1, 2, 3, hold on, 2, 3, 4, 5, 6, 7. Oh dang, it may be bulky, but hey, F. I'm sorry, guys. This thing's just terrible. I mean, like, you're only carrying 4 things and it's just $200, bro? Like, oh, hell no. Get this thing out of my face, dude. We're not looking. Hold on, why do you have to close that one off? I need to see some stuff on that. Why are we even looking at that? Like, look at this. This is $130. Like, bro, oh my god. They're out of stock right now, but they'll be back in stock later. Like, bro, $130 in this thing. That thing was $200. Heck no. This is an F. This is not coming out of the, what is it called, the woodworks at all. That one's staying in the woodworks. That's staying where it is, boys and girls. I don't ever want to see it again. Okay, now this one. Oh god. This one looks kind of dope. Don't you guys think? Look at this. Tourniquet, chest seals, flat ETD. Got the gauze, got the shears, got the NAR flat tape. You got the, my god, survival blanket. Dang, even they got the TCCC cards, dude. I love that. $200 for just an ankle is crazy. Yo, exactly, bro. Like, even WPS have better. They're selling it at $130. And they have far more content than the other one, and you're just paying just for the product, like just the ankle medical kit itself. Absolute failure right there, dude. I don't know. I don't want to see it. Yoda, you know, it's not ever coming out of the woodworks. It just stays where it is. So now we're talking about the Reflex IFAX system kit. What a mouthful, you know. For the basic one for $232. That's pretty good. That's pretty good. You know, pricey for sure. This one looks solid though. Exactly, bro. Exactly. It is pretty solid. It is pricey, yeah, but like medical content in general is pricey. And I always say this is that when you're buying these sort of things, just know that you can't put a price on a person's life, especially if that person's an innocent person, you know. When I say especially innocent, I'm not trying to say not everybody is innocent. Like, no, well, this person's more innocent than that person, and I'm going to go ahead and give that person more medical than this. What is it called, guy? Like, no. What I mean by that is I'm simply saying there's innocent from evil, you know? When I say for example, I stop a mass shooter or stop a terrorist or anything like that, right? And I neutralize the threat. And I'm thinking about getting some of these. I'm gonna have to pull this up for you guys, but I'm planning on getting like these rubber sort of like they're like these handcuffs in a way. They're like kind of like handcuffs and stuff, but they're rubber handcuffs, so you could be able to like, you could be able to, like, you know, cuff the bad guy. And then you can forget about this guy and you can focus on rendering aid on other people. Then say the bad guy, he gets back up and then he starts continuing to do his criminal activity. You know what I mean, guys? So that's the main reason why I would say I'm going to later on invest in one of these things, like these Cobra cuffs. And I'm thinking about getting them in like probably green or something. I don't know. You know, but to cuff them and leave them there. I don't even need to worry about like anything else. I'll just leave them there, focus on reassessing and, you know, rendering aid on medicals, people, and like doing my triage and everything. You know, this is kind of like what like even the everyday civilian can learn this sort of thing, you know, and they can also learn this sort of thing, like just to like have these sort of things. Yo, what's up, Choco Fitz? How are you? It's I. Exactly. It is you. So yeah. So that's kind of the reason why I say is that this thing's a pretty solid, sturdy build, although a little bit pricey, but it is pretty good. And it's not for the lay person, which is kind of a problem. And you guys probably wouldn't even understand, like, why would I have a TCCC card? But for a professional like me, this thing would be a lifesaver, guys. I would love to have this thing on my belt and stuff. I would even mind. And it's also pretty thick, and it's also more spread out, so I won't probably feel it on my back as much, you know? And then you could add the one that has the basics with combat guys, which is like $40 more, but that's okay. Or you could go for the advanced one, and you could get a whole lot more. And this is more for professional and stuff. So I'm gonna give this an S tier because it's a cool medical kit, you know? And then I forgot about the rig series, dude. This bad boy. We're gonna save a image of this because I want to be able to add this on my thing. I also don't want you guys seeing my stuff. So let me choose a file. I'm gonna add this there. Okay, now I added it. Okay. Yo, what's up, Necro Toro? How are you, buddy? So, oh yeah. So Yoda, he says, yeah, that one seems to be more to be the most diverse with equipment. Yeah, exactly, my man. Although expensive, it is definitely worth it. And so I hope I didn't get a little bit confused with the fact that I say that, you know, like discerning from innocent from evil sort of thing, you know what I mean? Like, when I go into a situation, I'm going to render aid on the people that needs it, and the bad guy, he'll get whatever else, rendering aid and whatnot if I do have anything, or first responders can deal with that guy later. You know, that's what I'm trying to say. People that are civilians and stuff, they're not a part of any of the crime and whatnot, they're going to get treated with, what is it called, with aid before that guy. I do not care about preserving that guy's life. If he's going to do something criminal like that, he's better off dead. I'm going to just focus on saving people that are innocent, that hasn't did anything wrong, and they are just living their life, man. Like, that's the thing. That's the thing. That's what I'm trying to say, you know? Hopefully I didn't get that confusing and everything, but hey, yeah. So Necrotoro, he says, currently slacking off at work, only have a couple of minutes. Oh, nice, okay. I mean, slacking off at work for just a few minutes because, you know, you just have like just those few minutes after work. It's nothing wrong with that, my man. There's nothing wrong with that, bro. There's nothing wrong with that. So this thing, guys, I honestly I'm thinking about adding this thing into my backpack. And here's the reason why. Like, what do you call those things? What do you call those things? Birdies. What do they call it, guys? Those, like, Ziploc bags. Yeah, that's what I remember. Ziploc bags. They're not very durable, guys. I've had my Ziploc bag in my backpack for, like, 1 or 2 years. The thing's already degrading on me. I don't like it. So I probably add this bad boy in there. Probably stuff some stuff inside of there. Who knows? Probably it'll be... Probably it'll take up too much room and whatnot. I don't know. We'll have to take a look, you know. I am one with the Ziploc, and the Ziploc is one with me. Oh, you're a Ziploc guy. Okay, I see how it is, my man. I definitely see how it is. I mean, the Ziploc is like, it's replaceable, you know. If it degrades to a point where you have to use another Ziploc to fix that, replace that Ziploc, then it's the cheapest alternative, you know? But I really want to have something that I can remove specific stuff out. And this thing, dude, this thing looks pretty solid, dude. This also comes with cat tourniquet, ETD gauze, combat gauze, and then you got the hyphen chest seals and black talon. Let me go and open up that other one that I had. Where was that other one? Guys, I think I lost it. Oh, there it is, right here. This thing, get the heck out of here. So let's see. Reflex IFAC system, which was basically, we'll go to the basic, the bare bones, you know what I mean? So you can see that there's no survival blankets, okay? Oh my god, there's no trauma shears? God. Well, you could always add that to your backpack. There's not too much of a problem there. But, you know, although it doesn't have those things, you can probably add those things, you know? Like, let's say for the advanced. Dang, man, you could definitely add a lot. Look at that. Yoda, he says, I'm trying to get a tourniquet. Tourniqueted? Oh, yes, sir. Oh, tourniqueted. Yes, sir. You gotta get those tourniquets, and then you get kitted out, my man. Oh, man. Oh, and to apply a tourniquet, I have to mention this. When it's applying a tourniquet, always, always, always remember to cinch it down as tight as possible, dude. Because the thing is, that person's gonna be screaming out and stuff because those things are really painful, dude. I've actually placed one on myself. That thing's pretty painful, dude. Oh my god, it is really painful. But especially if you're gonna move your leg and stuff and whatnot, or your arm, dude, that thing is gonna hurt. That's gonna hurt. Oh my god. But yeah, anyway, so this thing is, you can print like 3, 4, 5, 6, 3, 6, or 7, 8. Sorry, my stupid mind didn't even understand that. So you got like 4, 8, 7, 9, and 10. And we're gonna minus this one out. We're not gonna count this because we're not gonna see, like, you know, obviously, we're trying to talk about civilian situations right now. And also for the prepared citizens, so TCCC card could work, but I could definitely see this being a pretty cool little thing. And I actually probably add one of my own inside of there, because you can add a tourniquet inside. You can add, what is it called? You can definitely add a little survival blanket or two inside of here and stuff. You could probably even fit a, like, those MPAs don't really take up that much room. I have literally on the ambulance, the MPAs are not even inside of a bag sometimes. And it's not even about cleansiness about it. It's just that the fact that it takes up room, and sometimes you don't even need to worry about it and whatnot, because literally nobody's like going through them and like putting their dirty fingers inside of there and stuff. We just check on them and like check if they're stocked and whatnot. But yeah, it's pretty cool. It's pretty dope. We can't really say that, okay, well, oh my god, you can't do it. We can't compare. I would say this is for $200, if you were to go for the advanced, it's pretty good, but it being that much and not having as much, let me see, hold on, 6, hold on, wait a second, 6, 7, 8, I don't know, man. It's gonna get the 8s here, man. I can't say anything else about it. It's pretty good. But hey, we got the best things is if you want this one, don't ever buy this. Don't waste your money on that stupid thing right here from North American Rescue. I don't know what they made that product for. So useless, dude. But if anything, guys, get training and get the equipment and practice with it, dude. It is going to save lives. You can save your grandma's life. You can save your uncle's life. You can save a bystander's life. You can save, like, people's lives in a car crash and whatnot. You can even save your own life with this stuff, you know? And so that's the thing about this equipment. So I hope you guys did enjoy, you know, this stream and stuff. And I'm going to definitely start adding, like, timestamps to my, you know, my streams and stuff, especially when it comes to, like, these sort of streams and whatnot, because I want you guys to understand this different types of things, learn some things from them, and then use them effectively, okay? So yeah, definitely, I hope you guys did enjoy, and if you guys did enjoy, you guys know what to do. Subscribe and hit that bell notification, and also like. And yeah, if I missed anything, please do let me know in the comments, because this thing is a really cool like kit that I've like set up and everything. And so I hope you guys do enjoy that, you know, and I hope you guys learned something and whatnot. So yeah, it's like a continued education class for like some EMTs and paramedics and stuff at some point. Oh man, so very base stream. First aid kitting can save more lives than taking others. Exactly, bro. Sorry for joining at the end. Proud of your Fuse. Hey, thank you, my man. And so don't worry about it. We're all busy with our lives and everything, and you know, we're all busy, and I understand that not everybody's going to be able to make it to these streams. And matter of fact, not everybody have interest in getting prepared and stuff, but those that are interested, they stick around, they find these sort of things, they scour around the internet to realize being prepared not only can help themselves and others, but also help out first responders themselves, dude. Like, that's the amazing point about it. That's the whole point. Like, I was taking like my pediatric disaster response and stuff, and you would be surprised by how much help it would be if the parents, if the family members, if the kids were to get into being prepared at a young age, staying prepared, and it just makes life so much more easier. And for criminals, it'll make life a whole lot harder as hell, because if they're going to see prepared citizens armed and everything and whatnot, I don't think anybody want to go up against a bunch of people that are prepared for stuff, okay? I sure as heck doesn't want to, okay? You're going to have to be really well, like, thought out this whole plan to do these sort of things, you know what I mean? So, yeah. Choco Fitzy also says, I was honestly watching a Runa Galder stream while studying. My bad. Hey, don't worry, bro. We all have those things where we just want to, you know, sit back, relax, and listen to another person talk while we study. Although that's not my cup of tea, because I can't focus on the stream and also what is it called, the game. But hey, that's okay, you know. So yeah, or my studies, that's what I'm trying to say, you know. But hey, everybody have their own ways of studying, you know, and that's cool. So he also says, I thought I could get everything done, but I miscounted my time. Oh yeah, that happens to the best of us, man. That happens to the best of us. So, well, I'm going to go ahead and wrap up this stream. I hope you guys did enjoy. And if you guys did enjoy, like, subscribe, and hit that bell notification, and share this video to other people that you find, like, say, for example, like your friends or your family members and whatnot, because this stuff is not only for first responders, and that's what a lot of people think, that it's just for first responders. So, get out there, let people know, you know. Yes, thank you so much, and I'll see you later, Yoda, and I appreciate you appreciating me. I appreciate you too, Yoda, and I appreciate all you guys, you know, and I appreciate you guys, you know, coming in and, you know, joining me and everything and stuff. So I hope you guys have an amazing day. Please don't forget to wash those hands, take good care of yourself, and don't forget to respect everybody. Have an amazing day, boys and girls.